All right, Nora, let's get to your study. Time to talk about one of our favorite topics on the show, poo.
It's so true. You can't escape it. It's one of our favorite things. And this was a really interesting study that came out in December of 2022 in Lancet Gastroenterology and Hepatology by Bonwall et al. And this is the results of the early FMT trial. It looked to address the question, does the early use of fecal transplant during first or second episode of C. diff infection improve the rate of symptom resolution compared to the standard of care, which is treatment with vancomycin alone? And importantly, this was looking at the addition of fecal transplant to vancomycin. The trial was a randomized, double-blind, placebo-controlled trial. It enrolled 42 patients ultimately, and these were patients who were diagnosed with either a first or a second episode of C. diff infection. That's with greater than 3 watery stools per day and then a positive C. diff PCR. And patients were randomized either to fecal transplant after treatment with vancomycin for standard of care for at least 10 days, or just vancomycin alone with a placebo capsule. The fecal transplant was given twice, as was the placebo, on day 1 and day 3 through 7 for the second dose. And patients were followed for either 8 weeks or until C. diff recurrence, if it happened earlier. The primary outcome was the resolution of C. diff-associated diarrhea 8 weeks after the study treatment. And so the results top line were actually quite interesting. And the trial was actually stopped early after the interim analysis of the 42 of the intended 84 patients, because there was a significantly lower rate of resolution of C. diff infections in the placebo group than the transplant group. To put specific numbers to that, there was a 90% resolution achieved with transplant. That's in 19 of 21 patients with a fecal transplant, compared to 33% or 7 of 21 in the placebo arm. So I'm curious what questions you all had in reading this trial and what your initial thoughts were.
So I have to ask my standard first question. Paul, this was called the early FMT trial. So what do you give, A for effort, or?
I mean, I kind of like it. It says what it is. I don't know. There's nothing wrong with that. There's no shame in that.
Okay. They didn't really cram in an acronym, but
it was a trial that was done in Denmark, so I don't know whether they were just going for kind of clarity here.
So universality, right? It may not have translated
Exactly.
well. This might actually be.
I don't know what it was in Danish. Yeah.
All right. If any of our Danish listeners, please let us know.
I think we have some.
I'm sure we do. Yeah, I'm being serious. Please let us know if there was a catchy title to this one. All right, Paul, any comments about this one?
Nothing earth-shattering. I mean, I'd be curious to hear what the rest of y'all think, but like this all makes sense to me. It should have worked out, and it looks like it did work out. So I think just mechanistically, this kind of met what my expectations were going to be. So I couldn't find a whole lot to complain about, I'll be honest.
As I said to you beforehand, I mean, years ago on the show, we did a C. diff episode, and our guest said, I think stool transplants in the future will be given after the course of antibiotics to repopulate the flora. And I mean, it just like you're treating dysbiosis with antibiotics. That's the old way. Now this new way is like you treat the bacteria and then you try to repopulate with healthy flora again. So it does make sense mechanistically. And I mean, they were looking to enroll 84 patients here, right? And they stopped it early after they had only enrolled half the patients because it was working so well, and the 90% efficacy, that's pretty much what we've seen with patients who are getting it for a third recurrence, right? Like the more traditional threshold for prescribing this.
And I'll just add this for me was very reminiscent of that paper in 2013 in the New England Journal, not by the same authors, but that was kind of the first, paper to gain, widespread attention among a general audience, establishing the efficacy of FMT for multiple recurrences of C. diff. And that was also stopped early. And we talked a lot when that paper came out about what are the consequences of stopping studies early, I actually don't think that that's a huge concern for me in this study. They sort of captured the biologically relevant time frame for recurrence of C. diff, which CDC defines as the first 8 weeks. One thing that is a little troubling to me is that the amount of, or the lack of resolution in the VANC group was a lot. The VANC group did a lot worse than I think vancomycin treated patients typically do. CDC says that 1 in 6 people often are at risk for experiencing recurrence after their first infection. And, only, I think only 33% of patients had resolution of diarrhea after vancomycin alone in the placebo group. So I'm not quite sure what was up with that.
I do wonder, I know the inclusion criteria and exclusion criteria were a little bit more welcoming than other trials prior, in that they included immunocompromised patients who lived in nursing homes. So I do wonder whether some of that has to do with some kind of overall frailty and higher risk recurrence just in the population generally.
That's great though.
Yeah. So I think, Nora, do you want to get the take home points? Is there anything else you wanted to say about this one?
I think that this data is exciting to me and quite promising in terms of changing the standard of care for first and second line C. diff infection. The issue that we had talked a little bit about before that I think remains to be worked out is standardization of these products and accessibility of these products. I think in the paper they quoted something like only 10% of patients who were eligible for third line fecal transplant treatment actually went on to receive it. And so I think there's a gap between kind of the data and the eligible populations and actually being able to get it. But we do now have an FDA-approved fecal transplant drug as of December 2022. So,
yeah, I think this is. I think we're going to start seeing this once the logistics are worked out. I imagine this, and maybe there will be more trials, but I think we're going to start seeing it earlier. People go to these earlier than we have seen in the past.